Hi everybody, good morning and welcome to day 2 of our 5-pound weight loss challenge. My name is Dr. Carrie Felmley and I'm one of the functional medicine providers here at the clinic. Today I want to talk to you about a really important concept when it comes to weight loss, and that's actually getting our autonomic nervous system to work for us and not against us. So what happens when we come up against what we perceive to be a stressful environment is our brain is going to use what's called the limbic brain, and it's going to filter that experience through everything that we've gone through in our past to trigger one of the two sides of our nervous system. One side is called the parasympathetic nervous system, and that's resting, detoxing, healing. And then we've got our fight or flight response called the sympathetic nervous system that really helps us when we are needing to act quickly. Hundreds of years ago, this would have been used if we were trying to, for instance, run away from a lion. And our limbic brain and triggering the nervous system does not know. It responds exactly the same way as it would to that lion as it does to the deadline that's coming up at work that we know we're not going to make, or being late to pick up the kids, or any of those stressful holiday situations that we just found ourselves in recently. Our body is going to respond the same way. So when we trigger that sympathetic nervous system, a couple changes are going to happen in our body. Our body is actively going to try and make us as successful as we can to get away from that lion. So how it's going to do that is it's going to down-regulate the reproductive system and the digestive system in particular, with how much blood flow that it's getting access to, so that the blood flow can flow out to our arms, our legs, and our appendages, which are a lot more important for them to work getting away from that lion quickly. It's going to do things and upregulate things like our blood pressure and our breathing and respiratory system so that we can fill our body with the oxygen necessary to help us run away from that lion. It's also going to increase the amount of blood sugar flowing throughout our system so that we can metabolize it and have the energy to run away from that lion. And that's all well and good hundreds of years ago, and in very short periods of time, that works well for us. It helps us actually get through that stressful event. The problem with modern society is that most of us tend to have these very long chronic periods of time to where we are staying in our sympathetic nervous system long term. One of the hormones in particular that is going to stay elevated when we have triggered our sympathetic nervous system is called cortisol. The reason that this is so important is because cortisol is a fat-storing hormone. And so unless we get our nervous system working for us to where we can better regulate that cortisol, then we are not going to have near the success that we want to with weight loss until we start regulating that and moderating that and getting that a little bit more in control, which is this vicious cycle of a lot of us struggle with willpower to lose weight, and we feel the guilt when we're not perfect, thus making us feel more stressed out, increasing more cortisol, and making this a roundabout, slippery slope, harder process for us. And when we look at the main chronic disease states that we're dealing with in America, a lot of them have to do with having this chronic sympathetic nervous system triggered all the time. So we're seeing a lot of reproductive issues, we're seeing a lot of digestive issues, and a lot of health conditions that stem from those root cause digestive issues. We have a lot of really good studies coming out about how almost 80% of us, or even more, depending on which study you're actually going to look at, have some degree of blood sugar dysfunction. So we really do have a very bad problem of staying in that sympathetic nervous system. So the first thing that we need to do is try to cut things off at the pass in that limbic brain. So the first step to getting our autonomic nervous system working for us is to really identify different things, people, and places that trigger us and why they are triggering us. What have we experienced in the past that has been a stressful situation for us to where that has become a triggering event for us. Okay. Once you have spent some time thinking through that and figuring out some of those pieces, it's really important to be present in every single moment, to try and observe your thoughts, observe your emotions, and observe your breath. So a lot of us tend to breathe through our shoulders with very shallow respiration sequences. And in order to trigger the parasympathetic nervous system, which I'll talk a little bit more about in just a few minutes, is we really need to make sure that we're not breathing shallowly through our shoulders, but actually very deeply and from beneath the diaphragm. Once you have figured out what is triggering you and being really present in the moment to observe when you are being triggered and what you are feeling in those moments of being triggered, it's really important to take a moment and just breathe. There are a lot of different ways to actually shift from a sympathetic nervous system into a parasympathetic nervous system. But one of the fastest and easiest ways to do that is by breathing through our belly and not our shoulders. The easiest way to do this, I do find when you're not used to what this feels like, is actually to lay horizontally and put your hands on your belly. And what you are wanting to do when you're breathing in is you're wanting to see your hands expand upward away from you, and make sure that you are breathing deeply in that belly. You will find in the first few respirations that even though your hands are down on your belly and you're intending to breathe deeply through your belly, you still feel it in your shoulders. So if you can take a few moments to just breathe in for 5 through your belly, hold for 5, and breathe out for at least 5 counts, and do it 5 times. Actually, that in and of itself is enough to shift you from that sympathetic nervous system into the parasympathetic. So if you can observe and start to identify when you are being triggered, just taking a moment to take a deep breath and do that for a couple different respirations is enough to kind of help start to shift your autonomic nervous system back towards the parasympathetic. So part of being in the moment is when you are actually sitting down to a meal, is making sure that we're not doing it hastily. We're not doing it quickly. We're sitting it and enjoying every single bite of food. So when you are chewing through your food, make sure to chew it thoroughly, and instead of taking a few bites and swallowing. That's the first steps to digestion, and the latter parts of digestion are very, very difficult if we haven't actually slowed down, taken a minute, and chew our food properly. The second one is to really just chill out and be very forgiving of ourselves, have a little bit more compassion for ourselves. And it's so much easier to have compassion for other people. And I think a lot of us lose sight of having compassion for ourselves. And I do see that frequently in patients, is it's a lot harder to have compassion for ourselves than it is for somebody else. So if we can take a minute to start to show ourselves some compassion and think through things that we are grateful for, both in ourselves and in our environment and in our life and in our world, then we can start to focus on the positive, and our limbic system can start to filter and trigger more of the parasympathetic when we start to acknowledge those things more often. So I would encourage you to do a few things today. The first is to take a few minutes and identify those things, those people, and those places that trigger you, and try to avoid them wherever you can if that's on your way home from work. But be an observer in the moment-to-moment time of if you are currently triggered in your sympathetic nervous system or not. And if you are, take a few moments to think through that stressful environment and take a deep breath. The first thing is to take a deep breath and just take that moment. After that, make sure that you have compassion and gratitude and start to think about the positive. So if you can check off those things today, that's a really good starting point to make sure that we can get our autonomic nervous system working for us and not against us.